If you suffer an ACL injury and decide to undergo surgery, what does that surgery actually entail? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. I provide education, information, and commentary on all sorts of sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. In recent videos, I've talked about what an ACL injury is, the anterior cruciate ligament of the knee. I talked about how you tear it and why it's such a big deal. Basically, it doesn't heal on its own. And I talked about one of the challenges with a torn ACL is that you can have an unstable knee. The knee buckles or gives way when you go to do physical activities, landing from a jump like in sports or whatever your exercise is, or when you go to twist on it, you feel like your knee is giving out. And we've talked about who potentially can avoid surgery for an ACL injury. But so many people end up undergoing surgery because the knee is unstable. And there's two reasons for that. One, because the knee gives out when they go to land from a jump or they plant their foot and turn, or there's a risk that it will give out, they can't do what they want to do. It's hard to play a sport like soccer or basketball or football or tennis or so many other things with an unstable knee because you can't plant your foot and change directions. You can't land from a jump or your knee may give out, so you can't do what you want to do. And a lot of times, even in a custom ACL brace, you can't do it. That's the first problem. The second problem is that you might do more harm to your knee if your knee keeps giving out. If your knee buckles like that, we know that you can damage the cartilage, the articular cartilage lining on the ends of the bones. We know that you could damage the meniscus, the C-shaped shock absorber within the knee, all of which could lead to changes that turn into arthritis down the road. We know that's possible. So what then does surgery involve? We do 100,000, maybe more than that in the United States every single year, what we call ACL reconstructions. Now I said ACL reconstruction, not ACL repair. We can't sew the torn ligament back together. This is very much like a rope breaking, and if you look at the ends of the rope, you have the frayed edges, and you wouldn't really be able to repair that by sewing it back together. Same thing applies here. They tried that, I think, in the 1980s, and it failed miserably. So what we have to do is make a new ligament. And yes, I know there's trials to try other types of treatments, but right now, the standard, and it's been this way for 20, 30 years probably, is to go and make a new ligament using tissue either from your knee or from a donor's knee, a cadaver or an allograft. And we'll talk about graft options in an upcoming video, but you essentially use tissue to make a new ligament. We might use the middle part of your patella tendon or one or two of your hamstring tendons and basically drill tunnels in the bone to basically pass it up into the knee and make a new ligament. You hold that tissue in place with screws or anchors or buttons or various things like that, and then that graft becomes a new ACL over many, many months. And that works really well. We know with most of these surgeries, roughly, at least using your own tissue, an autograft, by about 6 months, that graft is as strong as the ACL in your opposite knee. Now, I'm not going to tell you it's not a big deal. Yes, it's an outpatient surgery, but it's painful, it's stiff, it's hard to lift your leg right away, it hurts to bear weight. We're going to limit all your activity or a lot of it right after surgery. We'll talk about what the rehab entails in another video, but I would never tell you it's not a big deal. Not only is the injury a big deal because it's going to be a lot of time out from your sport or your exercise and time away from your teammate, but the surgery is long. I tell patients that my part of the work is about an hour to maybe 90 minutes, but the patient's part of the work, your part of the work, if you have one of these injuries, is 4 months, 6 months, sometimes 12 months to get back to the way you are before you tore your ACL. Okay, have you suffered an ACL injury, and what did you do about it? Did you have surgery, and how did that surgery go? Do you have advice for people going through this surgery? I'd love to hear your thoughts, and I know viewers all over the world would love to hear what you have to say as well. So below this video, share your comments, share your experience. I, again, would love to read it, and I know it would provide value to so many other people. If you know somebody dealing with an ACL tear, please share this video with him or with her so that it can help as many people as possible. I really want to get people information that they need. If you like videos like this on sports and exercise, injuries and surgeries, subscribe to my YouTube channel. Click the button in the upper right corner of the page. I record a couple of these videos every single week, and they'll get delivered directly to you. Thank you so much for watching. It means a lot to me that I have the opportunity to help in any way I can, and I look forward to seeing you right here next time.